Welcome, everyone. I'm so happy to have you all here with us today. We are going to spend the next hour learning about healthcare directives and looking at the comments that everyone shared in the chat as you entered the room. There's lots of questions about how do you get started? How do you have those conversations? Where do you go for information and all of that? And we're going to be covering all of that information and more. So my name is Sara Croymans. My photo is on the right-hand side there. I'm an extension educator out at our Morris Regional Office, working in the area of family resiliency. And my colleague, Sam Roth, who is also an extension educator working out of Scott and Carver counties, will be my co-presenter today. So we're so pleased to have everyone here today. Also, I'm pleased to have Rick Meyer with us. He is one of our regional support staff, and he is serving as our webinar producer today. So if you have any tech issues, feel free to private chat Rick. He's going to help us monitor the chat box, and he's going to put some links in the chat as well as we cover different items. Please know that we will be sending a follow-up email that will include a PDF of our PowerPoint slides, and we'll also include all of the links that we are sharing. So know that those will be coming to your inbox in an email. Also know at the end of the webinar, we will be sharing an evaluation link. And in that link, you will be able to request a certificate of participation. And those of you that are University of Minnesota employees on the insurance program, if you're seeking well-being points, you will do that through the evaluation link that will be shared at the end of the webinar. So we're going to go ahead and get started here. So what is advanced care planning? And we have the subtitle now more than ever. You know, a few years ago we had COVID hit, and there were some really dicey months, right? Probably anybody that you spoke with knew somebody or who knew somebody who knew somebody who had passed away from COVID. And for Sam and I, that really motivated us to start getting the word out about healthcare directives. And so we're going to look at these items today. How do you make those decisions if you are incapacitated? We're going to look at some of the terms and language. We're going to talk about what kind of information do others know if they are going to make good decisions for us, if we're not able to communicate that. We are going to focus on Minnesota healthcare basics here, but we will be sharing a link later if you are in a different state on where you can find information out for your state. We'll also be looking at some common myths and facts, so hopefully we'll set some things straight in your mind. And we'll also be sharing some resources to help with those conversations and planning. So you will leave with some tools to help you move forward. So this slide here really helps us look at the why. So we know that adults of all ages face the risk of incapacity due to an accident, injury, or illness. Now in the chat, as we got started, I saw some folks that were concerned about their college age students that don't have a healthcare directive, or a 30-year-old son, right? So it's folks of all ages that are really at risk of being incapacitated. And it's not just an old person thing, right? Or an older person thing. It's for everybody. And the majority of deaths involve decisions about medical treatment and care. And that's all well and good if we're able to communicate what we want done. But if we're not able to communicate that, then we need different measures in place for that. So we're going to move forward here. The challenge is that others may not know what we want done. And so we, as an individual or as individuals, for me, I want someone who's going to be making the decisions that I would make. I want them to base their decisions on my preferences and wishes and not theirs, because we don't all think alike. But so we, again, have to put things into place. And it's so very true that the right to decide does not end because of incapacity. So even if I'm not able to express my desires on healthcare needs, I still really have that right. And so that's why we are looking at the healthcare directives. Um, so advanced care planning, right? So that's what we're talking about here. And that's a term that you may not be familiar with. It literally refers to planning and preparing in advance by sharing your preferences and wishes to increase the odds that the individual's preferences will guide their care in the event that they don't have the capacity to communicate or make their decisions. But keep in mind that definitely there are some boundaries and limits to what you can ask for. So if it's an issue that's relevant to all adults, and it gets really complex when we don't know what somebody wants and they face incapacity. So the importance of advanced care planning is really critical to be able to share that information with folks. So Rick is going to pull up a poll for us here. And we are interested in, where are you at in the advanced care planning process? Now, Sam and Rick, for whatever reason, I don't see the poll that came up. So Sam, can you moderate the responses to the poll for me?
Sure. And everybody's answering right now, so
Perfect.
everything's fine. So we'll give about another, 30 seconds or so, just so everybody has time to go through. You have a lot of options, and you can choose multiple ones too, as well, if you would like. And we'll do about fun. I've never seen a poll go down before and then come back up, so that was kind of fun. All right, we're gonna go ahead and close the poll and share our results. And it looks like majority are looking at need to learn some basics to get started, or they have good intentions but have yet to take action. And I think that's where a lot of people gets, kind of stuck. Like, we know we don't feel comfortable just diving in. So hopefully this can help you do that as well. And then the next closest one was having communicated decisions with important others. So that's really good too. And we'll talk about that importance of communication. So thanks for answering that for us.
Thank you, Sam. I appreciate that. All right, so we're going to jump right into another poll. This is one of our myths or facts. Which is true about advanced care planning in the United States of Minnesota? So go ahead and respond to those. And Sam, once again, if you're able to moderate that piece for me, I'd appreciate it.
So unlike the other one, this is a one option only. It's not a multiple choice. So feel free to read through those statements and pick which one you think is true about advanced care planning. And I think I might have given that A is not true away with the last poll, saying that most of us are wanting to learn more, or trying to make the decision about what to do. So no worries if you already answered A. You may not have caught that. But we'll give you about 10 more seconds for the few of you who still need to answer it. And we'll go ahead and end the poll and share as well. And 78% said none of the above. A few people did say A, and about 10% picked B and C as well.
All right, thank you, Sam. The correct answer is D, none of the above. So 78% of you were spot on. So thank you for responding to that myth or fact. So this is what the research suggests, and we just saw that on the poll, and we saw that on the poll with all of you, that the majority of Minnesotans are not prepared. And they either don't have a advanced care plan or a healthcare directive, or they don't have an up-to-date one. Research also shows that many individuals trust family members to decide. Um, and that's all well and good, but most family members have not talked about their preferences. So trust is one thing, but if you haven't shared what you want, how do you know that they're going to do the steps that you want? So many families, most family members are uninformed because those conversations haven't happened. And then family members aren't typically able to predict what decisions others would make or why. Um, and that includes longtime spouses, right? Or partners, adult children, right? We might assume that they would know what we want, but that is not the case. Um, 62% of Minnesotans 50 years of age or older have not filled out a healthcare directive, so they have no written document explaining their wishes. Of those that are 50 to 59 years old, almost three-fourths, or about 73%, have no healthcare directives. So as we get a little bit older there, and this compares to 45% of those who are over the age of 75 that don't have a health care directive. Minnesota's advanced care planning doesn't really look very different from individuals in other states. Individuals who have been diagnosed with life-threatening diseases or illnesses, people who are older, and those who are receiving care in a skilled nursing facility are typically more likely to have completed an advanced care planning document than the general public. And that's probably because providers are nudging or asking folks for that. Way too often, family members say, well, if only we had talked about this. And that's usually at the moment when it's too late. But the best way to ensure that your wishes and desires are known and followed in the event of incapacity is to put those wishes in writing, and to do that in advance. And we encourage doing that for a variety of reasons. First, it helps ease the burden for family members and care providers, right? It takes off the pressure because they know what you as an individual would want. It also can help reduce unnecessary stress in a medical crisis. And for you personally, it might help reduce your own fear and worry about healthcare decisions, because you know you have a plan and you know you've communicated that with others, and they are willing to follow that. So there's two parts to this. And Sam, I'm going to pass it to you, I think. We're going to look at the who and the what.
All right. So wait, I have to, yes. So again, the who and the what are your preferences and wishes? Those are central to kind of like our core being and thinking about our values. And we're going to also think about a couple of scenarios. So our first scenario, oh, that's right. I have to, did you give me control, Sarah? Thank you.
Probably not, but I'll advance slides for you.
Okay, thanks. So our first scenario is to think about this example and put yourself being Anna to help us think about the realities of end-of-life decision-making when a family member does lack that decision-making capacity. So again, read along and think of if you were Anna. So Anna is 38 years old, and she was hit head on by a drunk driver and has permanent brain damage and multiple internal injuries. Rick is Anna's husband and believes that Anna would want to not have further treatment, given the fact that they've had earlier conversations about the probability of no recovery, as well as the future quality of life. But there's nothing in writing about those conversations or their decisions. Anna's parents are still alive, and she has two sisters, and they believe that everything should be done to prolong Anna's life. So if you have a piece of paper nearby, or just mentally in your head, think about what your answers were. So if you were Anna and in this situation, and you couldn't communicate. So before this happens, if you were Anna, who would you want to make your healthcare decisions and why? And what would be the most important things you would like to have considered in that decision-making process? We'll give you a few moments to think about that.
So Sam, do you want folks just to jot some notes or do you want them to share it in the chat?
Just jot notes. We're going to come back to this, and it's okay if you
Okay.
share it in the chat as
Okay.
well.
Thanks.
But yes, just kind of think about who would you select as well. Okay. So we also have another example. So let's, a little bit deeper dive into the realities of end-of-life decisions as we learn about Jose, who lacks decision-making capacity at the moment. So again, as if you were Jose, you are 70 years old, you're very healthy, active, and an independent widower. You were diagnosed with a severe case of COVID-19, hospitalized, and you are in an intensive care unit, and you are unable to communicate at this time. For significant others, you are a widower, but you do have a polite but very distant relationship with your daughter who lives in another state. You also have two siblings that you've always had close relationships with who live nearby. And you have a special friend that he spends a lot of time with and you share common interests with. So again, if you were Jose, oh yeah, it does say share in the chat. So feel free to share in the chat this. So if you were Jose, who would you want to make your healthcare decisions and why? And again, what would be the most important things you would like to have considered? Oh, wow, Jose's gotten almost all siblings and a few special friends. And for Anna's, we have a few questions about what exactly is the medical condition. Quite a few people are saying husband should make the decision. Yeah, or Rick, who's also the husband. Okay. So scrolling back down. Yeah, and then a few people also said consider for potential recovery. For Anna, it was how severe is the brain damage? So I'm hoping that both of those cases started you thinking about the who and the what. And I know as we were getting, starting, people were sharing I have two daughters, who do I select? My current person just passed away. Now who do I select? That kind of stuff. So start thinking about that. Of course, it could be a different scenario for your own situation, but it gives us an opportunity to think about what can happen in those and when something like this does happen. Both of these situations, there's complexities. It's not a cut and dried answer as we look at this. Also the dilemma that people can face when there hasn't been advanced care planning and doctors and nurses trying to decide who is the decision maker and not wanting to have to go and figure out who that person is in the middle of that. So we're going to come back to these scenarios as well. But what exactly is advanced directive? So it is a legal tool to push your wishes regarding who and what in writing. It's literally what it says. It is a directive, and that is important for us to understand that, sharing the directions in that in advance of becoming incapacitated or needing a healthcare decision to be made. There's also different terms when we talk about healthcare directives, and understanding those terms is important. And sometimes they can be confusing or they have changed their meanings over time. Again, it's a legal tool and policies do vary from state to state. I mean, we hope everybody from Minnesota takes this, but we realize there might be people out of other states who are here as well. Or if you're somebody who winters in another state, that could influence your decisions. The state policies could be different. It's not uniform in the United States, so that's important to understand. So if you're helping, parents in Missouri or you spend 6 months in Florida, you'll also need to learn about those policies. Again, there's the link to the resources that Rick has put in for the other states, as well as in Minnesota, we do have a healthcare directive and policies regarding its use and purpose. The most and significant changes and the last changes were made in 1998, 1999, and the 10 years before that, a living will and power of attorney for healthcare were approved for that. So we just talked about a power of attorney. We do want to like have people understand that advance directives are not the same as having a will. A will is meant to distribute your property and assets after death, including your non-titled property. It's not the same as a power of attorney. A power of attorney really looks at your financial affairs and keeps them in order and figures out what to do with those things. It's not the same as a living trust, which is meant to, again, be another asset management and transfer tool to make sure that it goes where you want. And often taxes are considered when you're looking at trusts. And it is different from a medical order. So medical orders are typically do not intubate or do not resuscitate. And a medical healthcare directive is different from a medical order as well. It could include the medical orders, but it may not. So, you know, it's really important too that you should take time to find and verify if you already have advanced care plans, if they do exist. Where is the document? Who has it? What does it say? Especially if, you know, if you are somebody who went and did this before 1998 and haven't looked at it again, it's always good to review that as life circumstances change or perhaps laws can change. Okay, so we do have another poll for you all, and so it is a true or false. There is a required healthcare directive form that needs to be used in Minnesota. I do see a question. What happens if you live in one state, but when it comes to emergency, they send us to Minnesota? So your healthcare is in Minnesota, is what you're saying, Patty.
Yeah, that's a good question,
Yeah,
right? I'm
right.
not exactly sure, but I would think if there's referrals and things and you bring a healthcare directive from your home state,
That they
I would
would.
hope that they would honor that,
Yeah.
but I'm not 100% sure on that.
Yeah, we've never had that question before, Patty. So thanks for asking it. All right, we'll give you just 5 more seconds to answer. We've got pretty good participation already. And I can just, looks like almost 60% have said it is a myth. And everybody else said it's a fact who participated. And the answer is, it is a myth. This question is, so a lot of folks find this confusion because I'm going to give you why. So there's a policy in Minnesota that specifies what a healthcare directive should include, but there is no one required form that has to be used. So we're going to talk a little bit more about that. And there's some suggested forms that are available through different places, and they hopefully will meet all the legal criteria of what is required here in Minnesota. Again. So there, like I said, there's the 6 important criteria to think about. And when it was updated and changed in 1998, 1999, it was really trying to simplify so people didn't find this such, overwhelming thing to be done. The intention was not to require any one document because what they found is that providers were each requiring their own. So the person who said, they live out of state but often are referred, that hospital system might have their own advanced healthcare directive that they would prefer you to fill out. There's also competition between forms, and that was eliminated. So you can, just pull out a piece of paper and start your healthcare directive. And so what is the criteria is that it does need to be written. It does need to be dated. It has to state the person's name. And this is a good time to include the middle name or any other things that might go with a name. My dad is Donald Roth, and there's another Donald Roth who lives about 15 miles away from him. And so, you need to make that clarification. They're going to use the same hospitals and clinics and that kind of stuff. So good to put the person's name. It needs to be executed by a person with capacity to do so. That's why the date is important. If there's some, issues with memory or other things, then they'll look at the one that was most recently dated before those issues happened. It does need to be verified by either a notary or 2 witnesses. And those witnesses cannot be the person who is going to be who is a part of it. We'll get more into that. And it needs to include either health instructions, a healthcare power of attorney, or both of those things. So, I mean, that's how you can just pull out a piece of paper, but it's also, for most of us, we need some prompts and some structured questions to answer in order to develop a quality healthcare directive. Most of us don't have that experience just creating one and want some guidance with that as well as being able to decide who's going to be your healthcare agent. And so, if a form seems intimidating, you can also just keep it simple. Do that piece of paper, write down your wishes. I'm naming so-and-so to be my agent. Who are they? And sign it and follow the 6 rules that we have shared as well. So we're going to put in a link that gives you access to the University of Minnesota Extension's Healthcare Directive as well. Most, individuals knowing what kind of information to share and more details about the kind of choices they are making. This form that is in the chat, and we'll include that in the follow-up email, is designed to help individuals to complete a healthcare directive on their own. It also includes instructions for completing the 3 key parts of those documents. It also includes definitions of terms, duties, roles, and powers. It reflects the best practices and the type and depth of information most useful in times of capacity. And its choices and options are allowed in the state of Minnesota statutes. Okay, I think that's everything I want you to know. So that is the toolkit as well. And it is available in Spanish as well. So the whole purpose, again, is that it's something that reflects your wishes about who and the what. They typically will go into effect when an individual does not have medical decision-making capacity. But what does that mean? And I've seen a few questions coming through exactly what does that mean? So in Minnesota, it is defined as the ability to understand the significant benefits, risk, and alternatives to proposed healthcare and to make and communicate those decisions. It is specific to healthcare decisions and does not include the capacity to make other types of decisions. So stock markets, investments, balancing checkbooks, some of those financial decisions could have its own definition. It also should sound familiar from our discussion of informed consent processes and rights for individuals with capacity. So determining capacity may sound simple, but it is not as well. So the realities of dementia can offer challenges to assessing that capacity for medical care providers. Healthcare providers are the ones who decide who has healthcare decision-making capacity. So if I have my healthcare directive signed, I've got a legal document. As long as I have capacity, I am in charge. The provider should be talking to me personally. When they're not able to talk to me personally, that is when the healthcare agent is the person who comes in and does that for me. So the definition of a healthcare agent is one or more persons legally authorized to make healthcare decisions for you if you become unable to do so. If you look at this, there's a whole section of what are those health agents' duties. And the agents you name are under no legal duty to act. They must be available and willing to serve when needed. And I've seen a few comments talking about like, what if I'm just too emotional? That's when if you are that person who is named as the agent, you do not have to act. Somebody else could step into that role until you're available, or that's when you do a substitute healthcare agent. That's not the right word, but we'll get there. Healthcare agents don't have to sign the form agreeing to be named when you complete your healthcare directive, although it is important you ask them that they're willing to serve in that capacity, because if you already know from the get-go they're not, then you might want to rethink who you're deciding on it. And you also want to make sure that they're willing to go along with your wishes as well. Don't surprise family members or friends by naming them in this position without discussing it with them, because then that really makes it a challenge as well. Often, healthcare providers will consult with family members when things are happening, but it's very helpful if providers know and your family members know and who has been legally determined to act. As you prepare your directive, you're really working on picking somebody that has qualities you desire in a decision maker. And again, talk to them in advance, make sure they are willing and possibly available And what does that exactly mean? We're going to go back to Anna and Jose. Again, if you forgot, Anna was the one who was hit by a drunk driver, permanent brain damage, and multiple internal injuries. Jose is diagnosed severe case of COVID-19, hospitalized in an intensive care unit, and unable to communicate. So again, think about who did you select as your decision maker and why. Now think about like what quality. We already shared who did you select and why, and what are some things you wanted to consider, but what exactly are the qualities of that healthcare decision maker you considered? And first person said, Anna's husband, because they have been talking about this issue, is one of the qualities. So somebody who's informed, I would take that as well. Any other qualities that you think when you were selecting who Anna and Jose's persons could be that you looked at? And most of you did say the husband. For Anna or Rick, and for Jose, you talked about the siblings or the special friend. A long-term relationship, ability to be selfless, right? Someone who can think critically in an emergency situation as well. Yep. So thanks for sharing that. So you're right. Like when we think about the qualities of agent, what does that mean? So we really want to be somebody who's there to advocate for you and is not intimidated in healthcare settings. I always share my 3 brothers have all passed out walking into a hospital. And so therefore, we're never sure if they're really going to be able to be there for my parents. So I'm the healthcare person because I don't pass out. So that was a simple solution for my parents to decide between 4 children. May not be the case in your family. You also want to make sure you have someone who can cope with making the difficult decisions. Those decisions are not easy and they are often complicated in the event of incapacity. So you're asking people to take those difficult decisions and make them under stress. So again, qualities of an agent, we need them to be 18 years of age or older. A lot of you mentioned being trustworthy. Having similar values and beliefs will be a lot easier for them to make decisions that line up with yours versus somebody who isn't or doesn't have the same values and beliefs. Willing to listen to and carry out your preferences. Able to be an advocate, not easily intimidated. They can cope with making difficult life and death decisions, and they can make decisions under stress. So oftentimes we will consider, our family members, including spouses, adult children, who we think may be ideal candidates, but they also may not be ideal candidates. Experience in the family suggests that family members may be too closely connected emotionally to be able to carry out your wishes, or may have very different beliefs and attitudes, making it difficult to follow through with those wishes. So think carefully about what qualities you want an agent in your life, who makes sense. Have conversations with that person or people that you're considering as well. And you may have to do some homework to figure it out. It, may not be able to decide in 5 minutes. A common mistake is people will pick the adult child who live closest to them geographically. And geography really isn't the issue as it was, 20 years ago or even 5 years ago. It may be also that that's really the wrong person because they don't meet any of the other criteria other than being, close physically. People also tend to naturally to think I have to pick a family member because that's who I should pick, or going with the oldest family member. But think about, those many people outlive family members, that emotional situation. So if you have another person in mind, you could do that person as well. Again, that who and the why, so that we don't pick the wrong person or people, and spend some time thinking about qualities that and who is important in your life. So I see a few of you have questions and we have a poll. I love it. As we go to the next slide, people are like, wait, what about this? So how many healthcare agents can be appointed to make decisions for you? So somebody has said 2 agents already. 1, 3, question mark. All right. I love just the question mark. Thank you. However many you choose, one or more, two, one. Yep. So all good guesses. And the answer is, I'll let Sara answer it.
Thanks, Sam. Well, you can list more than one. I'm not sure that we're going to be doing 148.4 people, but you can list more than one person. And as Sam was talking, I really am thinking I'm going to be interviewing some people to see if they have the qualities that I want them to have. And again, if they're interested and if they're capable, if they're willing to do that. So you can have more than one person, and there's could be value to that as folks are working on making decisions for you. So they can make decisions if you have more than one person. They can act alone, or they can act together, and you can indicate that on the form, the suggested form that we have provided, or if you decide just to use a piece of notebook paper or a Word document. And so that is a good deal. A person's preferences may reflect variations in cultural groups as well, emphasizing the group or collective decision making over individual decisions. And this also allows parents to avoid having to select one child over other children or a spouse, when they may prefer to identify several people as their healthcare agent. But remember that when you work with a group of folks and you're asking them to act together, that might be difficult for them to be available for one thing, but then to agree on decisions. So guidelines for the decision process need to be included. For example, there are examples in the form. So if you want folks to perform or act alone or together. And for example, if the first person isn't available, you could name an alternate person so that it could move down the line as well. And that's where we get to the second bullet here on naming an alternate agent. And this is really critically important in case someone's unavailable or unwilling to carry out your wishes. And so having alternate agents is probably a good deal. Someone had mentioned early on that they needed to update their healthcare directive because the person they had named as their agent had passed away. And so by having an alternate agent listed, that would help in this situation. Now, there are some additional powers that can be granted to an agent. And so the powers of the agent are the same powers that you would have personally if you had the capacity to express those. And so in this process, you're going to make some decisions about what powers you're going to give them. And that's explained in the document that we will be sharing that link for, and that'll be in your follow-up email. But basically, you're giving someone the power to make all of the kinds of decisions and get access to all of the information that you would have had as an individual. New in 1998, so this one is good. So we've been talking about incapacity, but a change in 1998 is that even if you are able to make decisions or speak for yourself, you may opt to have someone else make decisions. So for example, a 95-year-old woman may decide, I'm still capable of making decisions, but I just want my son to make the decisions. And since she trusts her son and does not want to be bothered with the details, she may choose not to be involved. So there is an option to indicate that I want this person to make decisions even if I am capable, right? So something to think about. It's also important to identify who you want to make decisions about your body after you die. And this is often the same person, but not necessarily so. Um, so, um, do you want to give your body to science? Are there other things? Do you want cremation? Do you want a funeral, a memorial service, all of those sorts of things? So those can be indicated as well. And you can also limit powers. So you may choose to limit your healthcare agent's powers, and the form gives very specific examples of what those might be. So part one was looking at the who. Now part two, we're going to look at the what, and that's the leaving the instructions. And so to help make sure decisions are based on your values and preferences, that your wishes are shared, here's some things to think about. So what are the important factors for others to consider when making decisions, right? What are my overall goals? What's important to me? What are my feelings about specific medical treatments? Right? We want to be able to share those. Maybe there's some that I would opt to have, and there might be some that we would opt not to. What about religious or spiritual beliefs? Right? Your healthcare agent may have different religious or spiritual beliefs than you. So it's important for you to share those and have those be known. What are your beliefs about the quality of life? And what does that mean? What defines good quality? And the length of life. What are your wishes for care when dying? And what are your wishes about donating organs and tissues? And so the suggested form that we shared has space for you to fill that out. And people oftentimes have very strong beliefs about the quality and quantity of life, and they have had thoughts about what they would prefer as they near death. And they may have some wishes again about the organs and tissues. And so the worksheet in the suggested form really helps you walk through those things specifically. So I like this sign here, under construction. So your preferences are typically always under construction. And so it's going to take some time to think through your concerns and your fears, and thinking about what are the most important things that I want those healthcare agents to know when they're making decisions for me. And as I'm getting a little bit older and getting a little bit grayer, my preferences and wishes have changed a little bit over time as I've aged, as I've gained experience, as I have experienced death with family members and people that are close to me. And so again, it's really important to review what you have and to see if it's still how you are thinking. So we asked early on, as people were coming into the room, what concerns or fears do you have? And then and so a lot of people talked about not having anything in place, worried about adult children. We saw several folks that indicated that they were concerned about not having anything into place. Would people be willing to make decisions for them? If folks can respond to this second question in the chat, that would be great. What are the most important things someone should know when they're making decisions for you? So if you can share your thoughts, what are the most important things someone should know when making decisions for you? And as people are putting questions in there, Michelle asked, doesn't your driver's license indicate the donor preferences? Yes, if you choose to indicate you're an organ donor on your driver's license, that'll be there, and that'll be great. But let's say you did not indicate that, but you did include that in your healthcare directive that you wanted your organs donated, then your healthcare agents could still go ahead and do that. All right, so what's most important for things here? The core beliefs, feelings about quality of life. Yes. Yep, that your preferences should be honored. Core beliefs, religious or otherwise. As long as I'm aware enough to communicate my preferences, they should be honored. And Christy, I argue that even when you are not able to communicate those, if you have documented your preferences, they should still be honored when you are unable to communicate those. So the values and beliefs, yep, that quality of life, right? And that means something different for everybody. So thinking about what does that mean for you, right? That I'm able to go for a jog every morning, or that I'm able to sit up in a chair and have a conversation with someone. I mean, for everybody, that is going to be really different. So think about what that means to you, and document that, share it. Virginia doesn't want to be hooked up to machines, right? And so um, that is important to her. Yep. Deb, thinking about what are the limits? What's my prognosis? Yep, that personal definition of quality of life again is a big piece. Yeah. Thank you everybody for sharing those. All right. So there are many factors about how we think and feel and act about advanced care planning. Um, And so I encourage everyone to think about any of the factors that are on the screen that influence your preferences and wishes. You know, and again, we all think differently about leaving instructions. And it will definitely take time, and it may involve talking with several people. So do not expect to do your directive in 1 hour. We had someone share in the chat earlier that they started, I believe you had indicated you started working on your healthcare directive and it got too emotional, so you had to set it aside. And that is perfectly okay, right? This is heavy stuff, right? We're doing some really big thinking here on our futures, right? And the futures of our family members and our loved ones. And so it is perfectly okay to start the process and set it aside and do some processing here. So some of these factors, the current and projected health status, right? What is the diagnosis? You know, and are there some good treatments? Are there choices available? Or maybe there aren't. What are the approaches to healing and health? Beliefs about causes of illness might impact or influence how we feel. Trust of healthcare, right? Some of us have great trust in the healthcare system and other people may not. And so you will want to be sure to address your concerns in your directive, or if that's influencing your thinking, make sure you're covering the appropriate bases there. Do you have trust or experience with legal system, like in religious, spiritual beliefs and practices? The family communication one is always important to address and to think about. Are there rules in your family, right? Are you able to talk about death and dying and respect and privacy? Or is that something that's just not talked about in your family? Who typically makes decisions in a family? Right? Is it always the male or the oldest child, or is it the matriarch, right? If you don't buy into those and you don't want that person to be making decisions for you, it's really important again to identify your agent and share your wishes. And then if you've had previous death and dying experiences, both good and bad, those are going to influence your decision making. All right. Um, with COVID the last few years, and thank goodness things have slowed down and we've got our vaccinations and we're not hearing about as many deaths as we once had, but there was a lot of work happening around COVID and healthcare decisions. And so we will be sharing this link in our follow-up email as well. But there's some great resources related to COVID and healthcare decision making. So we have talked about part one was the who, part two was the what, and part three is making that document legal. And I think Sam indicated earlier that the document needs to be dated and it should be signed, right? So we need to have it signed and it should be witnessed by that notary or to individuals who are not named as agents. And so make sure that you have the bases covered there. Yeah, so those are the basics about making the document legal. So now what do you do with the document, right? You're going to want to get some copies in your medical record. So give a copy to your clinic and your hospital, wherever you might frequent with healthcare providers. Definitely give a copy to those healthcare agents, and hopefully you've had a conversation with them ahead of time about, would you be willing to do this for me? And do you feel like you would be able to to do that. Sam, I feel bad that your brothers pass out when they go in a hospital, but I know you'll do a great job for your parents. So maybe, you know, there's people you're thinking of might be in that situation as well. So have those conversations. So give a copy to those agents, give a copy to your alternate agents. And then it might also be good to give copies to family members and close friends because they might be the people who start questioning your agents. But if they can see and read what your preferences have been, they're going to be more supportive, most likely, of your decisions that you have shared. Also, I love this tip: keep a record of who has copies. Right, very important to do, especially if down the road you decide to update your document. You want to make sure you go back and give everybody an updated version of that form. So it is an ongoing process, and we've talked about that. So a healthcare directive is not a one and done sort of thing. You can change it, you can revoke it as long as you are capable. And so some good times to review for potential changes if if there's a change in your health status. If you move to a different state, we've been talking about that. And if the availability of your agents or alternates are changes, right? Those would be good times to review and see where you are at. All right, so another chat here, and we're good on time. We'll be getting to that evaluation link in a few slides here. Are healthcare providers required by law to follow my care directive? So give us a yes or a no in the chat on that one, or a true or false, whatever you want. I see lots of yeses. I'm seeing a few no's. Majority of yeses with, again, those no's sprinkled in. Are they required by law? All right. By law, healthcare providers are required to follow your healthcare directive. And by law, your family members are expected to follow your healthcare directive. So the answer is true, but there are, you know, maybe people have heard of exceptions to that, probably that's most likely. But the point is that most healthcare providers are delighted when they have access to the decisions and wishes of the person, right? That they've put those into writing. It really makes everybody's decision making a lot easier. So know that the intent is that the decisions really do make a difference in your care. But there may be times when you have a provider who doesn't agree or doesn't want to follow your decisions, and they may choose to step aside at that point and have another provider step in. So it's really about the conversation, and we've talked about how communication is so very important here. So we encourage folks to don't let the suggested form dominate the conversation, but share your thoughts and concerns. You know, again, what are the most important things that agents, family members, and providers need to know, and discuss with healthcare providers and important other people, you know, and especially if you have a healthcare decision, then you can have some really specific conversations about your provider about your situation. But I think it's really difficult to over communicate in a situation such as this. All right, Sam, I'm going to pass this off to you to bring us home here.
Yes, so we've talked about a lot today. And these are just a few additional resources that will also can help you along this journey if you have more questions. So the first one is the conversation project. How do you approach the subject? Most of us don't want to talk about our own mortality or about our parents' mortality or others' mortality. So this helps you get started. And COVID-19 did bring to light that healthcare directive is important at any age. It's not just for an older population. So this can help you with that conversation. And then there is also the Legacy, which is another resource that is available. And their mission is to educate and empower people about the importance of personal healthcare planning through conversation and inspiring action to be able to go and actually do this work as well. So we'll share both of those resources in the follow-up email. And we do have our last poll. So thinking about everything we've talked about in this last jam-packed hour, we know it's a busy one. What are some of the next steps that you plan to do, in the next couple of days, in the next couple of weeks? We don't want you to have these resources and then set it aside and not think about it. So, what is that action you're going to take coming up? We'll give you a few more seconds to finish doing this, doing the poll. All right, and we are going to close it up now. So if, click quickly. And majority of you have said that you plan to talk with others as the number one action. Oh, this is fun. It almost goes in order. So C, if you put that C, D, E, and F are all really close. And, if you pick G, I'm guessing you've already have one in place. So maybe you're looking at updating it, reviewing it. Anytime there's like a medical change in your own, that might influence what your decisions would be. Somebody mentioned that their healthcare agent passed away. So then that would need to be updated to have options there. So thanks for sharing that. And we hope you follow through on those actions as well. So it's really important, why are we talking about advanced healthcare directives is that we encourage you to start planning yourself for today and dig in, use that toolkit, ask your hospital system, clinic system if they have resources. It's important to do it for yourself so that you have some control. All of us like having a little control over our life. Do it for your family members, help the healthcare providers provide what you want, and think of it as a valued legacy. So this is just kind of the nuts and bolts. There is a certificate of participation that is available, as well as UMN well-being points for you or if your spouse works there. And so if you would like to do that, like Sara mentioned at the start, please fill out that evaluation and that will give you an opportunity for both the UMN well-being points as well as a certificate of participation. And we'll put that link in there. We do have more webinars coming up, including Talks in Spanish that you can feel free to share with others. Finding Balance, Later Life Decision Making, that is the series that this webinar was under. So when you do the evaluation or put your well-being points, you'll want the Later Life Decision Making category for it as well. And then we also have Making Sense of It All, which is our financial side of things. No Place Like Home and Recovery and Health. And What's for Dinner? There's a whole bunch coming up all the way through December, so feel free to join. Again, we encourage you to connect with us. We'll have all of this information in the follow-up email because we know it is almost 2 o'clock and you probably have things to do. Sara and myself and Rick will be hanging around for a little bit. If you have additional questions or topics that we didn't address that we missed in the chat earlier, please let us know. And thank you again for attending.